Good morning, welcome to Health in North Coast. My name is Rosalind Foy, I'm a psychiatrist at Lismore Community Mental Health, and this is Sarah Lewis, who is a nurse that works in the acute care service with me. We're going to be talking about perinatal depression today. Perinatal means around the time of birth, maybe from the start of pregnancy to up to 1 year after the birth of the child, or for some definitions it means at 20 weeks gestation or up to a month after the birth of the child. And this is a time that's very big in the life of the woman and the couple. There's lots of changes. In our society we're greeted with many images of what motherhood and having a child means. There's lots of ideas about how people should be and how they should be able to act, to the point that it's almost a sacred thing amongst mothers and babies, the way we picture them. But in fact, during pregnancy, many women experience depression, and actually 10% develop clinical depression. After childbirth, usually 3 to 6 days after, 60 to 80% of women have hormonal changes which present as what is called baby blues. Because there's a sudden drop in estrogen and progesterone levels after birth, women can become quite irritable, can be crying for no reason, oversensitive, feeling tired, anxious, sad, not able to sleep. Sometimes people say they can't show feelings, but at other times they feel quite happy and they're feeling quite confident and calm. This can last hours or days and usually resolves by 2 weeks. But 10 to 15% of women go on to develop a mood disorder, and this can be what's called postnatal depression or postpartum psychosis, which is possibly a phase of bipolar disorder. The symptoms of postnatal depression include the ones found in baby blues, but they're more severe. The other symptoms they get are a depressed mood, worse in the morning. They can't sleep, they can't feel motivated to do anything, so a woman might feel that she's unable to look after the house, barely able to feed the baby, change its nappy, can't cook meals, just feels overwhelmed by what's going on around her, can't enjoy things, not even the newborn baby, doesn't feel like eating, feels quite worthless. Sometimes they can be very slow in their thinking, walking and talking. And it can happen in the first 4 weeks, but it can be up to 3 months and even up to a year after the birth of the baby. The factors that could lead to people developing postnatal depression are a past history of anxiety and depression, a family history of psychiatric disorders, and past experiences that the woman has gone through herself. The depression can be precipitated by changes in social circumstances. Often women are moving, they might have problems in their relationship with their partners. There's not much social support. They might live a long way from their family and not have their mother or members of the family there to help them. It might be also due to a difficult pregnancy or birth. Some women get non-stop morning sickness throughout the pregnancy, not just for the 3 months. And difficult births could include caesarean sections or complications like forceps delivery. Also, the baby's temperament can also affect how a woman reacts. Things that keep people depressed are the woman's personality style. If you're a perfectionist, you tend to feel more stressed in the postnatal period. Every woman complains of not being able to sleep, and that's always a problem. You might have an unsettled baby, and again, when you don't have enough social supports, family to help, a partner that's also able to help during the night feeds, for example. But what does help against getting postnatal depression is a mother's own resilience and a good social support network. It's not just mothers that will get depressed at this time. Fathers also can become distressed, especially if their partner's depressed. The problem with having postnatal depression is that it can lead to what's called poor attachment between the mother and baby. Attachment's the biological need for the infant to seek protection and emotional support from the caregiver. So that means the baby needs to be close to the mother. And if separated from the mother, this activates the attachment system, which means the baby starts crying, tries to go to the mother if she leaves, and when the mother comes back, the attachment system then is deactivated. The baby calms down and is feeling secure. When the baby feels safe and secure, it's able to go and seek out new things, explore new things, and come back and enjoy it with the mother and feel that life is safe and they have a secure sense of self. So a mother has to be able to respond through empathy, which means that she can feel what the baby is going through and does her best to try and fulfill the baby's needs. And this process happens through what we call mirror neurons in the brain. Something in the brain between the baby and the mother communicates directly without words or many thoughts, but something somehow through some kind of neural pathway we're able to sense what the baby is feeling, and the mother is able to comfort the baby if that's what the baby wants. And by doing this, the baby starts getting a sense of self, is able to regulate its feelings and understand the emotions of others. However, if the mother's depressed and emotionally unavailable for the infant, the baby's unable to learn how to effectively regulate their own feelings and self-soothe. For example, if a baby cries, it's asking to be picked up or comforted somehow and have its needs met, whether it's being fed or have its nappy changed, or its position changed, or just to be held. A depressed mother won't be so in tune with her infant and may not be able to respond effectively to the baby's discomfort. Then the baby doesn't know how to elicit the care that the baby wants and doesn't really know what crying can mean, and then their emotions become mixed up.
And the guilt with not being able to feel one's doing their thing can snowball into anxiety, and supports is what it's all about, because women aren't alone. It's really well recognised now, postnatal depression, particularly the bonding phase, and we ourselves as adults, and when we're pregnant, we talk about self-soothing ourselves. So the mother's often overridden by guilt and anxiety, and biologically can't eat, can't self-nourish. So it's a cycle that people would hopefully be attuned to observe when people are struggling, as a lot of different families have different ways of expressing their need for help. But that's the message here we're giving with the postnatal information, is to know when one is getting quite severe down the track, because we all have our limits with sleep deprivation, etc. But what Dr. Foy's really talking about is the slowing down that the biological depression can give to the mother, which is a recipe for disaster if help isn't asked for. And more and more though, people are able now to talk about this. More and more information, more and more acceptance of our multifaceted roles, stressed lives, and all the other factors that go with it.
So in attachment, the baby needs to feel safe and secure 50% of the time. So the mum doesn't have to get her responses to the baby's cries for help right all the time, just half of the time. As long as the baby doesn't get extreme feelings of distress and not too often, the baby will be fine. Because attachment is also the basis of a person's relationships in later life. How we attach to our mother is also reflected later in our what is called internal working models. That is, our past experiences inform our way of how we have relationships with other people later in life. So adult relationships, romantic relationships also are affected by how we bond as infants. If we've had a negative experience like being harshly criticised or overly protected, we might develop low self-esteem or have a pessimistic outlook, and this leads to a higher risk of postnatal depression and makes adjusting to parenting more stressful. Sometimes some mothers say that they never want to be like their mothers, that they want to do things completely different. This is in fact reacting to the past experience rather than acting, that is, doing what they think is right. They're doing the opposite to what their mothers did. It's hard not to parent in a way that we have experienced ourselves. Postpartum psychosis, you get severe depressive symptoms as well as psychotic symptoms, such as hearing voices and delusions, that is, false beliefs that are fixed. For example, the mother might feel guilty about doing something terrible, that the baby's unwell, or that they're going to do something to themselves or the baby. The mother could become what's called manic, feel very high, believe that they have special abilities, not sleep and don't feel the need to sleep. It's very rare. It only happens in 1 to 2 per 1,000 births, but and it happens quite quickly after birth, usually within the first 2 days. There might be a history of similar episodes in the past in this woman's life, or a family history of the same. It's a high-risk time for the mother and child and needs hospitalisation. So we have here the overstressed mother trying to juggle everything in her life and her child's life. Because this time is such a big change, not only does a woman have a big change physically in their bodies, they also probably have to stop working, which is one of the reasons people have self-esteem is what they do professionally. So that's a big change in their lives. Also, their relationship with their partner goes into different roles. Perhaps as a couple without children, there might have been a more equal sharing of house duties, but now as the stay-at-home mother, it tends to fall on the mother to look after the house and the father to bring do the earning of income. So there's a lot of changes for the mother at this time. Also, quite apart from becoming a mother themselves as well. So the important thing is to ask for help, and that many women unfortunately think that they have to do all this alone, that they have to be perfect mothers, that everything comes naturally, that somehow as soon as the baby comes out that they're supposed to know how to feed the baby, change its diaper, how to put it to bed. All these things are actually something that you need to learn, and there's lots of help out there to help you learn how to do these things. So it's important for a mother to recognise that depression is quite common, and caring for a baby 24 hours a day is not an easy task. Sometimes women expect themselves to immediately know what to do, feel that they should be able to cope all alone without help, and be able to guess what the baby wants all the time, which is actually impossible. They can't tell you, but you will soon learn certain signals that tell you give you a hint about what's going on for the baby. As long as the baby doesn't have extreme discomfort too often, they'll be fine. And it's also important to recognise that you get frustrated, that if you can't sleep, you can't have a minute of your own, that you can't go for a shower or to the bathroom without having to think about what am I going to do with the baby, or the freedom just to get up and go out and take a walk, and also the loss of your whole life before the baby came in. It's okay to get frustrated and actually voice your feelings about this. So it's important to look after yourself, ask for help, make sure you make time for yourself, get sleep when you can. Also, don't expect so much from yourself. There's no right way, there's no parenting manual that says this is the way to do it. Everybody has to find their own way, and every mother-baby pair is different. How you react to your baby is unique, and only you really know about you and your baby. People can give you advice, but you will know for yourself what feels right for you. Also, often breastfeeding is quite a stressful time. If baby doesn't latch on, some women get quite anxious about that. Sometimes it's not possible for a woman to breastfeed, and that's all right. And breastfeeding at night time stops you from sleeping. Perhaps all that's required is to use a breast pump and feed the baby with the bottle at night, so the mother can actually get some sleep. Also to ask for help from all the community services that are available. Also not being afraid to tell someone how you feel. Often a lot of women feel that they go to a mother's group, for example, and feel that everybody in the group is coping, why aren't I? And they don't want to tell anybody about the problems they're having. But in fact, everybody has problems, everybody needs some help, but it's a question of whether you feel able to ask for it.
Also, particularly with the journey from the first book-in with the treating team and the midwives, and they have a wealth of information and they're very intuitive, seeing you at your most vulnerable and your family often at their huge adjustment. So the early childhood nurses at the community centres, where you take baby to be measured and weighed, or your GP or your GP nurses, they're the ones that really have the local resources that can really be of help. And they're no stranger to all degrees of distress, medical right through to emotional, mental, domestic violence, drug and alcohol. There's many clinicians specifically trained for a woman in the perinatal period, which is from first known pregnancy till the baby's 2 years of age, that are there for people to link in and utilise. And we didn't have a lot of these resources several years ago, but it is a matter of networking, because every community, every town has their own resources, but they are out there.
Sometimes depression can't be picked up because they're the same symptoms as women have that are looking after a baby, like feeling tired, not being able to sleep, not wanting to eat. And then some days might be okay, but if these symptoms last longer and you start not enjoying anything, you feel like you can't do anything, that's when you need to talk to someone, tell them about how you're feeling. So Sarah was telling us about some community groups and non-government organisations. Here's some numbers that you can contact for yourself, like Tricyclen and Karatani, which are baby centres that run helplines and websites, and also have residential care for people who would like to learn about how to settle a baby, also even for toddlers if they're not sleeping so well. More nearby to us here is the Ellen Barron Centre in Brisbane. Joining a mother's group also seems to help. There are websites like the Post and Antenatal Depression Association, PANDA, the Australian Breastfeeding Association, Pregnancy, Birth and Baby Helpline, other organisations like Brighter Futures, Sustaining Families, a family care centre which helps with people on a day-to-day basis about feeding and settling baby, the Family Support Network Incorporated, Mums Using Substances Program, the Mental Health Access Line, Beyond Blue, the Black Dog Institute, and the Family Referral Service, which is a service that should be able to help you contact all of the above. On top of that, you can present to community health centres, talk to your early child nurse. They usually come to visit in the first couple of weeks after you've given birth. Also talk to your GP. There's many ways to get in contact with people. So the things that we can do to help, just sometimes talking about things can help. It can be enough to help a mother get through some of these feelings of helplessness and despair that you can get when you haven't had enough sleep and the baby won't settle. There's also cognitive behavioural therapy, what we call CBT. This can help with feelings of panic, teaches you how to breathe and control your anxiety, and helps you reframe thoughts like, I can't cope, this is too much for me. And somehow, if you know you can control that, that will make you feel better. This is done by going through your social worker at the hospital, through early childhood nurses or community health centres. And it's usually done by social workers, nurses or psychologists. You can also go and see doctors, see your GP, who then might refer you on to see a psychiatrist or a psychologist. We can talk about medications now for postnatal depression. If you've seen the doctor and they've thought that medication is required, we might put you on an antidepressant. There's certain ones that are better than others in that they've been around longer and there have been more studies about the effects of medication during pregnancy and also during for breastfeeding. Overall, there isn't much difference between old and new antidepressants, but the older ones have a longer follow-up period because they've been around longer, so from the 50s rather than from the 80s and the 90s. There's certain ones that shouldn't be used, like Arapax, which is known to cause heart defects in the first 3 months of pregnancy, and monoamine oxidase inhibitors like Nardil or Parnate, which can stop fetal growth and cause higher blood pressure in the mother. There's some recent research that shows that antidepressants like citalopram, fluoxetine and sertraline can cause serious newborn lung problems like persistent pulmonary hypertension of the newborn, which means the baby has difficulty breathing if it's taken in the last half of pregnancy, as well as heart defects of the septum, which is the wall between the left and the right side of the heart. So I would normally suggest people go on to a tricyclic like Dothapan, in a small dose. You start at a very low dose, like 25 milligrams, and it can go up to like 200 milligrams. So there's a lot of room to play with for antidepressants. And it's also safe for breastfeeding. For the more severe illness of postpartum psychosis, we might also add antipsychotics, which help with the delusions and hearing voices and belief that things are just all going wrong. We I would put someone on an older antipsychotic like haloperidol, which has been shown not to have significant problems in pregnancy or breastfeeding. The newer antipsychotics like olanzapine are used sometimes, but it can cause weight gain, which in pregnancy, which in itself can cause problems in the baby's neurodevelopment. So it's something to consider. It's good to talk to your GP or psychiatrist about these things, because it's better to be well and in control rather than being unwell and not taking medication. If you want more information about medications to use in the perinatal period, you can contact MotherSafe. So it's important that we get help and feel good about ourselves and our baby, not be depressed, so that in the future we can also be a help to our own children when they have their children, and to be the best grandmother that we can be as well. Thank you. It's just another name. Partum means childbirth, so it's just after the childbirth. And natal is just around birth. So the same thing, basically. Be there for her. Say that this is quite a normal thing to happen. It happens to a lot of women. Encourage her to talk about her feelings, and if it concerns you enough, to consult your general practitioner or the early childhood nurse or anyone that you can come into contact with around this time. At the hospital, if you're concerned about that, it's always just good to talk to the nurses there. But as we were saying before, within the first 2 weeks, it's quite normal for a mother to feel irritable and crying sometimes and just all over the place. But if it goes on for more than 2 weeks, you should see the GP. Also, as we said before, a lot of fathers feel the stress of it. It's important for them to talk about their feelings with the GP as well. Important to get help from outside. Well, that's $1 million question. It depends on the person. If there's a history of depression in the past, it's likely to be something that's going to recur, and so we would normally say, I mean, it's just a kind of rule of thumb, it's not set in stone, that we usually treat 6 to 12 to 18 months past the length of the period of depression. So that's quite a long time if you're planning to have another child. So I would say at least 6 months for a woman that's had postnatal depression, and at that time to discuss with her GP or psychiatrist what to do next, because a lot of women don't want to be on medication when they fall pregnant, which is fair enough. But if they're likely to relapse, it's better to be on medication and pregnant than not be on medication. It's the chances of getting postnatal depression are higher if you've had it once. And I think you need to be able to enjoy your pregnancy and your childbirth and feel that you're at the top of your game rather than struggling even before the baby's born. It's hard to say, but the risk is higher that once you've had it once, it's something that needs to be monitored. And, you know, it's not something that you say, well, I'm better now, so I'm fine, or I can just walk away and never see another doctor again. I think you need to be sensible about it and keep an eye on it and see your GP at least and have a discussion about medication, or it might not involve medication, talking to a psychologist or counsellor about fears around the births. Some women get very anxious about their second birth. They might have had a traumatic first birth. They get quite anxious about actually having another child. That is worth talking to someone about. Stops some people getting pregnant again, unfortunately. It's part of the attachment thing that if your mother's not really looking into the baby and going goo goo gaga, aren't you cute, aren't you the best little baby in the world, that if the mother is, well, a depressed mother tends not to be able to look people in the face, and so the baby will lose out on the gaze of the mother, which is really important. That's part of what I was talking about, the mirror neurons, that they are actually firing whenever a mother looks at its baby in a loving way. So a mother that's depressed can't do that so well and is not so able to respond to the baby crying, might get frustrated with the baby crying and actually reject it. So all these things will have an effect on how the baby feels that it's being looked after, whether it's feeling secure about being safe with mother, and that has kind of long-term effects. Having said that, as long as there's someone around that is able to respond to the baby 50% of the time, like the father or the grandmother or an aunt or a friend, the baby will be fine. But a depressed mother will have difficulty doing the attachment, with bonding with the child so that the baby feels secure.
Well, just on that note, babies are very resilient, and often mothers are the ones that need the input and the caring after birth, that first 2-week window, and that in itself is a hard exercise for someone who, as a mother, many roles, in charge, controlling the household. So babies are very resilient, and like Dr. Foy said, 50% of the time another family member being there is very normal.
As long as they're there for that time, baby will be fine.